Yeah, thank you very much, and thank you for inviting me to speak with you. Yeah, I'm going to talk about how transforming the non-T-cell inflamed tumor microenvironment, and the way we are doing it in our center is mainly by immunomodulatory vaccines, and the difference between immunomodulatory vaccines and traditional cancer vaccines is that we're not targeting the neoepitopes of the cancer cells, but we're targeting tumor microenvironment antigens, which is expressed not only by cancer cells, but also by other cells of the microenvironment, like immune regulatory cells or even fibroblasts and cells like that. So basically at this year's ESMO, which were 1 or 2 months ago, there was a very, very interesting phase 3 data presented by Hessel and co-workers who showed very, very interesting data with an immunomodulatory vaccine targeting IDO and PD-L1, and they showed I think it was 17. The median overall survival of the median progression-free survival was 17 months versus 11 months in the control arm, and it was even in the PD-1 naive patient it was 25 months versus 11 months. And you can say especially interesting for my talk was that in the PD-L1 negative patients, which are the ones which do have non-T-cell inflamed microenvironments, the response rates were the median progression-free survival in the vaccination plus PD-1 was 17 months versus only 3 months in the control arm. So that was PD-1 monotherapy. So this really highlights that the immunomodulatory vaccines do something to these patients that have, unfortunately, these non-T-cell inflamed environments. The phase 3 data was based on a phase 2 trial, which were conducted in my center at the Copenhagen University Hospital at Herlev. And what I'm presenting at ESMO IO is based on material from this trial, where we have been able to activate and isolate vaccine T-cells, specific T-cells. We have melanoma cells cultured from the patients. We have immune cells isolated. So we have been able to, in vitro, to basically study what happens in the patients in the tumor microenvironment during therapy. And what I will show data of is basically that we know that the vaccines is inducing both CD8 and CD4 T-cell responses, and we know that the CD8 cells can kill target cells. But we also have a lot of CD4 cells, and I show in the talk that these CD4 vaccine-induced T-cells are able to target directly both cancer cells, but especially myeloid cells, which they can convert into from being immune regulatory, immune suppressive, to actually anti-tumor cells that support the T-cell inflammation and the response. So basically, we have data showing the direct targeting of the myeloid cells, but we also show that indirectly by the activation of these T-cells in the microenvironment, we convert the microenvironment from a suppressive to an inflamed environment. Then I will, in the end, also talk about some other interesting targets which are developed, like arginase and TGF-beta vaccines, where we can show that we can target fibrosis, and that is, of course, not so clinically developed, but it will be hopefully coming in the coming years, very interesting immunomodulatory vaccines. I think that will all be my talk.